further ado, I would like to introduce Mr. Mark Cruz. He's joining us from the Office of Hope, and so that is Health, Outreach, Promotion, and Education. And so as you all have your questions for Mark, as he's talking, you all can quickly raise your hands, and I'll collect those from you. But he has a very engaging presentation, so Mark, if you want to come on up.
Good evening. With all these cameras in the applause, I feel like I'm hosting a variety show. I feel like I made it somewhere. So good evening, ladies and gentlemen, parents and guardians, and everyone in between. My name is Mark Cruz. I am a health education specialist at the Health, Outreach, Promotion, and Education Department, which stands for HOPE. I like Ashley's description. We are the HOPE office. It brings a lot of light to what we do. So HOPE is part of health services, and health services is a part of the health and wellness pillar. And we did a whole restructuring of Rutgers and the 4 pillars that hold us up. We described, and one of those is the health and wellness, which is that health services is a part of. One of the reasons why that pillar is so important is because we know that academics is very important. It's one of the main reasons why your students are here. But the success in the classroom, or excuse me, out of the classroom, is just as important as the success in the classroom. And health services loves to be a part of that and to make sure that your students get the support that they need to be a success outside of the classroom. So one of the things that I have to talk about are our 3 health centers that's found on campus. And I know I'm recognizing a couple of faces, so I do apologize if you've heard this presentation before. But there are 3 health centers on campus. There's one right on this campus. I think it's right past this building right here. It's called the Bush Livingston Health Center. We have our main and largest health center on our College Avenue campus called the Mercado Health Center. And finally, we have our newest and most state-of-the-art health center on our Cook Douglas campus called the Cook Douglas Health Center. And it's located inside the New Jersey Institute for Food, Nutrition, and Health. It's a brand new building. It's a brand new health center. So if you haven't had an opportunity to see it just yet, I do suggest that you go. They have a state-of-the-art cafe. Oh boy. They have a cafe there, cappuccino maker, the works. I love it. It's great. So if you haven't had a chance to go visit, please go visit us there. So in addition to our health center, what you need to know about our health centers is we are not a doc in the box. We're not an emergency department. We are a fully licensed primary health care facility. So we have licensed physicians, medical nurses, medical technicians. We have all that here for your students. Again, it's not a simple, hey, there's something wrong with you, we'll fix you up. It's a primary healthcare facility. So all of our healthcare services, our medical services, are acquired through medical appointments. So all of our services have to be made through appointments. And I'll give you that phone number right now, just so you have it. And I do have handouts as well, so you'll have that as well. But just in case, it's 1-848-392-7402. Again, that's 848-932-7402. And again, regardless of which health center your student would want to make an appointment in, they would just need to call that number. Okay, so again, all of our services are appointment only because we have over 40,000 students on campus. And I assure you, if we had walk-ins, nothing will get done that day because of the size of our student population. However, please don't think that that means we can't see your student the day that they need an appointment. All they would need to do is just go make that phone call, make an appointment to see if there's any availability for that day, and whoever's on the phone can help navigate that process. Maybe our Hurtado Health Center is still up, but maybe our Bush Livingston Health Center is open. So again, someone will be there to help navigate that process with them. Our health centers do specialize in men's care, women's care. If your students are managing any long-term medical conditions such as allergies, we do work with your students in order to kind of help them navigate that. If your students are planning on traveling abroad, we do work with them to provide travel medicine to make sure that they have all the necessary medication they would need while they're out of the country. And also, if your students are into any intramural sports or any collegiate sports, we do have sports-related specific medicine and physicians that can help assist them with that. So again, we have all these services that is available for your students. So I talked about our medical services. The next thing I'm going to talk about is our counseling services. Okay? We have 2 counseling services on campus. Our main one is located on our College Avenue campus on 11 Senior Street. And we have a satellite counseling center on our Cook Douglas campus. Again, easier to get to regardless of where you are. And one of the things that we promote on our counseling centers is not only our one-on-one counseling with a licensed physician, a licensed mental health physician, but also our group level counseling. And we promote our group level counseling because we find that most of our students get a little intimidated, maybe they don't benefit so much from one-on-one counseling, but they prefer it and they get more out of it if they're with their peers. If they're a group of their peers that's going through the same exact things that they are, so they're benefiting more from that experience when they're in group sessions. One of the things that we don't want, or we're trying to fight, is that stigma that's on, not just in Rutgers, but actually all campuses and universities around our nation, is that if you go into a counseling center, there's something wrong with you. There's something mentally wrong with you. You have a mental health disorder, you're going to come out with a mental health disorder. And that's something that we want to fight. That stigma is false. Sometimes our students just have too much stress, which I'll talk about later, or anxiety. 2 of the most common ailments, not only in college students, but people. Some of our students just may need tips on how to handle that stress or how to handle that anxiety while they're here. And again, we have licensed medical physicians to help navigate that process. In addition to our one-on-one and group level counseling, we do have alcohol and other drug assistance program, which stands for ADAP, and that program is intended for students who are kind of maybe having issues or struggling with their alcohol or drug use or abuse. And the reason why we have that is we know that the journey to recovery is difficult. We know that some students are already on their journey to recovery before they get here, and we want to offer them as much support as necessary to try to have a very traditional experience here at Rutgers. So we do have recovery housing available for those students, so they get to stay on campus, they get to have that traditional experience, a traditional dorming experience, with that extra support. So again, if ever you feel that your student may be, maybe relying on alcohol or other drugs for as a coping mechanism or whatnot, we do have services for that. And finally, we do have the college support program that's intended to assist students on the autism spectrum. They have specialized programs that help students talk to their professors about asking for extensions, asking for assistance with papers and things like that. But also they give a private tour of the campus to help the student on the spectrum, to help them navigate that transportation experience. Again, that is a paid-for service. You'd have to go on our website to see exactly how much that costs, because I think it depends on the semester. But again, that is a service that is available to all of our students. Albeit that one is by cost. Okay? One of the other services that I do want to talk about is our pharmaceutical services. One of the main things that students kind of don't know or kind of forget is you can fill your prescriptions right here on campus without having to go to downtown New Brunswick, without having to go home. You can do it right here at Hurtado Health Center or our other 2 health centers, because there are pharmacies right inside those health centers. So we fill prescriptions, we make sure that there are competitive prices, so whatever they pay outside of campus, they probably would have to pay again, whatever, they would pay the same amount here inside the campus. We also sell personal care products, we have safer sex products. Again, it's just like a mini CVS or a mini Rite Aid, and it's right here on campus for students. And last but not least, we have the Health Outreach Promotion and Education Department, which is my office. It specializes in peer education. There are a lot of things that our students should know about in terms of alcohol, other drugs, safer sex, peer mental health, and also nutrition. We have and train our own students to make sure they can go out into their college community and educate their peers about these issues. And the reason why we believe peer education works is because we feel that hearing the information from someone their own age, hearing the information from someone who's experiencing college like they are, means a lot more than hearing it from someone who's a staff, hearing it from someone who's a faculty. So again, that's why we train all of our students who's in our department to go out and do these speaking engagements for their peers. We also have a theater group because we know that sometimes specialized workshops can be a little boring. So we do have a theater group to go out into the community, again, to talk about these types of issues in a more creative way. So we do try to address these issues both in an educational setting as well as an entertainment setting. So we do have that for you. Okay? One of the things that I do want to talk about are our recreation centers. Yes, we talk about physical health, but let's talk about being active. We have 6 recreation centers here on campus that's free to all students. All they need is their RUID, and they can swipe in. They have access to all 6 of our recreation centers. So there's the Werblin Health Center on Bush campus. I consider it our main one. So they can use our Olympic-sized pool. They can use racquetball. We have weight rooms and gyms. We have a volleyball court. We have tennis courts right on this campus. So again, different ways for your students to stay active. There are classes that are available for students that you have to pay into. I believe it's $5 a class. There's spin, yoga, there's Zumba, there's things like that. Again, they're held at different times on different campuses. So again, if your student lives on on Cook Douglas, they have their health center, their recreation centers are specialized to kind of address those types of activities. Also, in addition to that, we have our recreation services offers personal training. If your students are trying to lose weight or trying to manage their weight, we have specialized services for that to help them lose that weight or manage that weight in a safe way. One of the issues that we're finding is there's a lot of body image issues that's happening amongst college students, and they're trying to manipulate their weight, right? Whether they're spending too much time at the gym, or they're trying to lose weight, or trying to bulk up. We have specialized services to make sure that there are personal trainers to watch over them to make sure that they are doing it in a healthy fashion. So again, that is for your students' convenience. Okay? Any questions so far? I know you have questions written down. Yes?
So, you said there are people watching over them.
Mm-hmm.
So if they're in a fitness center and they're using weights, there's someone there who's watching.
Yes, we always have.
If they're doing something incorrectly, it could be dangerous, or if they have a recommendation, they will speak to the student.
Yes, absolutely. We do have trained staff at all of our recreation centers and all of our gyms. And if they are doing something incorrect or if they're putting themselves at harm, the staff and faculty there will assist the student. But also, let's not discredit the other students that are there also working out. I've been to the gym, maybe not enough, but I've been there. And I'm just telling it how the reality of it all. However, I'm using a machine completely incorrectly. And our students do come and say, you're kind of using that wrong. And I really go, really? I wouldn't know. And they would, come talk to me and help me out. But again, we do have trained staff for them as well.
Another question.
Yes.
You mentioned that there are 6 fitness centers?
Yes.
Now, I know about Werblin,
Mhm.
I know about College Avenue,
Mhm.
and I know the apartments each have their own fitness center.
Yep.
Right here in Livingston.
Mhm.
There are 2 apartments.
Yes.
The next 4.
And then downtown New Brunswick. Downtown New Brunswick, we have one under Rockoff, which is a off-campus dorm. Is it near the bookstore? It's further down actually. It's actually further down near. It's kind of on George Street. It's right near. It's actually right near a clinic. Yeah. If they live in that, any type of Rutgers Recreation Center, they can just swipe in. Okay? So the only thing that they would need in order to access those services is their RUID. Okay? Again, just going into the rec centers. Any type of paid class, however, they would need to pay. Yeah. There's 2 in downtown New Brunswick. So there's one in George Street and there's another one. Okay? Yes.
Kind of answered the question that we were down, which was about wellness or health services. What about circumstances where, obviously, for a true emergency,
Yes.
but the 7 series type of thing, and it actually, our son last year could not get an appointment. I don't think we live close enough to that. He did have an emergency. He just couldn't get an appointment, and he did turn out to be pretty sick.
Yeah. We try our best to accommodate our students as much as possible, and that's not an excuse excuse on our part. Unfortunately, just because based on timing, based on our availability, it is what it is. And if it is a medical emergency, we do encourage not only your students, but hopefully their classmates, their roommates, or whatnot to call 911 in case of any kind of medical emergency, because our local hospitals are more equipped to handle those types of emergencies than we are. So if it was, in that case, if it was a medical emergency,
It wasn't when, and students, I mean, you can even necessarily want us to come.
yes.
I mean, there's that whole subgroup. It's not, you don't have a broken leg or appendicitis.
Mhm.
We consider it sudden serious. They may not even have their spiking fever or
Yes.
whatever it is. But really, you do try.
Yeah, and that's something that we have to kind of talk to our students about what constitutes an emergency. A medical emergency doesn't need to be that there's something busting out of your stomach or that your leg is broken. It could be a high fever that has not gone down for a while. It could be constant, it could be a sinus infection. It could be something like that. Again, if they don't leave as an emergency, that's something that hopefully we're trying to educate them on as my department. One of the things that we're trying to promote is the use of our flu vaccine shots that I'm going to hand out to you all. That way you know it's available. We do have flu shots available here at Rutgers. They can make any type of appointment that's convenient for them at our health centers. However, we do have flu vaccine workshops around campus throughout, on specialized days. So they don't have to actually go to a health center to get their shot. They can just, actually one is here at Livingston Dining Hall at one day. And they can just come here at their convenience whenever it's there. So again, we're trying to educate our students about what constitutes as a medical emergency. And there are phone numbers outside of the hospital that they can call. The nurse line number is another number that you can call. I'm actually going to give you all a very important blue card that has all the emergency phone numbers that you can reach out to in case the student calls you first. Because I know that in case of an emergency, one of the first people that I would call is my mom. I was like, something is oozing out of my body, I don't know what to do, and she would probably still tell me, call the doctor. So again, we're going to give you that information. That way, if they ever call you, you have the phone numbers to kind of give them and act as that resource for them. So at the end of this, I will give you that one. Yes?
So, you can't, I understand. So where does it go?
In terms of the medical emergency,
Well, I mean, it's, he's sick. He's really sick with the flu. Another parent has to drive down. We picked him up twice. Where do you send him to a hospital right now? Where?
There is Robert Wood Johnson right near, it's right in New Brunswick. So
So you refer him to someone?
any type of medical emergency, we do refer them to Robert Wood. There's also St. Peter's. Again, there's two hospitals right next door. They would probably have to call, they would have to call transportation. Yes, we do. We do have an EMS service. I can't stand here and tell you I know exactly how that works. However, I do know they have that service. I don't know if it's only for medical emergencies that are completely dire, but I heard of stories where some students have called. Yes. Most of our bus systems do go past Robert Wood Johnson, but there is a night mover that is specialized, especially at night when the buses are kind of on a slower schedule. They have the night mover phone number, and it will transport them anywhere they need to go. Okay? Yes.
That nurse line, what hours is it staffed?
Okay. The nurse line is actually staffed whenever the health centers are closed. So in case of a question that our students have, like, oh my gosh, I have my fever, or I have a high fever, I'm feeling this, I'm feeling that, and they want to get in touch with a Rutgers person or staff and faculty, and the health centers are closed, they can call the nurse line, and the nurse can actually, and again, it's registered nurse, they will answer any question that the student has. In case it is a medical emergency or needs something more followed up process, that nurse will then make that recommendation to the student.
The nurse is paged, or does the student leave a message and the nurse?
Someone is on there, someone is paid to stay on that.
Okay, so it's from like 5 without interrupting a class. It was really difficult because they run a different campus than other classes.
Yeah, so they should be trying to make an appointment, not your student, but in terms of our staff, they should be trying to offer suggestions on different locations. So the Cook Douglas Center as well as the Rich Livingston. And based on the recommendations, based on the things that the student says, and based on the specific need, it may be trying to be localized to for Title I. So again, I'm not sure exactly. But if it's something that can be done with all our health centers, there should be other options that the person is referring to. Okay? Okay, let's go with that. I'm sorry?
How much are the flu vaccinations?
All the students would need to do is bring their RUID with their insurance card, and it is there's no copay for the student.
Will we get a receipt how soon it's insurance?
There won't be any out-of-pocket costs, and I'm pretty sure you won't. You'll get depending on how your insurance itemizes things, it probably will state it, but it probably won't ask you for anything because it'll be covered by your insurance.
Thank you very much.
Yeah, no problem. Yes.
My son did have a flu shot here, and I said, bring paper, I want to see paper. He's showed it. I told him that's fine, but he said, oh, I threw that. So, when you go to a pharmacy or a doctor's office, I'm not sure about a doctor's office, but if you go to a pharmacy for a flu shot, you fill out that paper, they give you a copy, and you take it home. So I wanted to get it from my son to see that he really done it.
Yeah, when I was in college, I'm not gonna lie to you, I never saved it. I just like, oh, I got it done, it's done.
Well,
So
actually, he's on a cell phone now on a computer, so you don't have to collect papers, which makes
I can't even do
it
that with my Yeah.
Students are not in the habit of having papers.
absolutely. For me, a lot of paper scares me because that means I have to read through them. So I just
Not like in
check it.
papers.
Yeah.
About the flu shots, I wanted to ask, do you have any idea what percentage of the students, like resident, graduate students, actually get a flu shot here?
I know that it's over 50%. I don't know the exact number, but I know most of our students actually opt to get the flu shot here on campus. Yeah.
And another question about the meningococcal
Mm-hmm. Yep.
vaccine. I read something recently that before you move into a dorm,
Mm-hmm.
you're required to have it, and after a certain age. So in other words, if you had it before that age,
Mm-hmm.
then you have to get another one. Can you explain that?
I can't speak about that specifically. However, I do know that one of the requirements for any Rutgers students to stay on campus is to have specific shots. And obviously they're going to send their records in, and the records are looked at by our staff, and to make sure that one, it's up to date, and two, that it's still viable. So they are looked at, and if they're not passed, let's just put it this way: if your student is staying on campus, that means they, everything that all the paperwork that they provided has passed. Yeah. So again, but I can't speak specifically about that shot.
What is it called now, but maybe next year going on campus?
Mm-hmm. So they'll probably have to ask for those shots. Yeah. Yeah. Yes.
What's any student gets diagnosed with flu or something like that? There is a mandatory, so they pick up, they go home instead of staying in their dorm.
I have never heard of a situation where a student was asked to leave the dorm because of the flu. That would be more of a resident's life question. But if they're dorming, I've never heard of that situation. All I know is in terms of the medical portion of it, they would probably be asked to talk to our physicians to help them once they're medicated and make sure that they're keeping as healthy as possible. But again, I've never heard of a situation where they were asked to vacate the dorm because of the flu. Any other questions? Yes.
You talked about flu counseling for
Yes.
students. Currently, we have a percentage rate of how many students we have
Who offer the group one? We have a higher percentage of students utilizing our counseling services in general this year than compared to the other past years. However, and I don't have the specific data because that doesn't filter through my office, but we do know that there's more students utilizing our groups than one-on-one counseling. Obviously, because groups, there's probably 10 people there, whereas one-on-one counseling, it's more focused, so maybe that adds to the numbers. But we do see students saying that they benefit more from the group counseling because it's not as intimidating. And again, we have over 23 different types of group counseling on campus: social anxiety, LGBTQI support groups, children of alcoholics. And again, depending on what the current need is, new groups are being made as semesters change. So if we find that students are requesting a specific topic, our mental health physicians will create a new one to address those issues on campus. Okay? Yes, sir? And then we'll next.
I don't know if it makes sense, but do you do follow-ups or make follow-up appointments if someone's sick and they came for an appointment? Do you take the lead and have the follow-up, or do they need to make another appointment to come?
We all do, all of our services, both mental health and medical, we do follow up with the students. Whether or not they answer that follow-up follow-up phone call is out of our hands. We make, I think, 2 follow-up phone calls, but I can't stand here and tell you that they have been answered all the time. So we do try to reach out to them, again, to make sure that everything's okay, especially if it's, if they were coming back from the flu, we do make a phone call to make sure that they're staying okay. But again, the student has to pick up and answer.
You don't make an appointment that if they're there, say, okay, I want to see you back in a week or something at the time that they.
Depending on what it is, they do make the follow-up appointment. I thought you said a follow-up phone call, not necessarily. Okay, so we do, if it's a follow-up appointment, we do make them at that time, but if it's a follow-up phone call, again, we do make them. It's up to the student to answer the phone call. Okay, I had the same thing.
Do you have those counseling groups at every campus?
Just our College Avenue campus, and we have a satellite counseling center on our campus. There's no counseling services here on the Bush Living.
Is there no room?
It would probably be about room and also its availability of space. However, we do have different mental health physicians coming into different organizations. I know that CAPS usually works with our Office of Social Justice Education, and they have mental health physicians going to those organizations just to have a sit down and talk to any students that are there. And they do go into the different cultural centers as well. So although we don't have a set counseling center here, there are organizations that host those types of conversations. Yes, ma'am?
Do you offer lab services? In other words,
Yes.
you have to make an appointment to come in and have a lab.
Yes. So we do blood tests. We run the blood tests. If it's a blood test that was requested from a Rutgers physician, that blood test is usually covered through your insurance. Other blood tests that are requested through outside physicians, however, there may be a cost associated with that. But it is done here on campus. Yes.
In terms of like counseling,
Mm-hmm.
there is big suggestions. I was listening to the comment a bit about whether or not it's counseling available on this campus.
Mhm.
And I heard you say that counselors come into different organizations to help the students, but you're dealing with a student or students that may have issues like social anxiety, and they may not even be a part of those groups. So it may benefit everyone if there was availability on all campuses.
No, and that's a suggestion that we're considering. We do know that not having a counseling center here does quite a disservice to our students who are living here on this campus. However, unfortunately, due to space and limitation, that currently is out of our hands.
Related to that, which I was thinking about before, but every residence hall has these 2 residence monitors,
Hall directors?
older students or graduate students or whatever. Okay, all right.
RAs or hall directors? Mm-hmm.
Now, if a student has another problem, whether it be physical or emotional, they can go to the RA.
Mhm.
To the RA and say, what do you think I should do?
Mhm.
Right? And now, are the students told that they should feel free to go to the RA, to go to the RA?
From what I know of Residence Life Training, they make sure that the RAs are equipped and trained to handle these types of situations. They are encouraged to refer back to the professionals, so health services, health centers, counseling centers, RUPD, anything like that, the RAs are trained and they have all the phone numbers necessary to make that referral.
And they have good relationships with the students that, like, under four.
Absolutely. The RAs are also encouraged to hold events on their floor, or at least in their building. At least I'm assuming once a month. Again, I'm not too sure about that. About around once a month to make sure that they're well known around their floor. To make sure that the students do know them. That way, the students are more comfortable around them, and make sure that if there's anything that they need to talk about, the RA will be one of their referrals. Any other questions? Yes.
Hi, all the information that you're sharing with us, how are the students made aware of this? And you said that they're educated on this, and how do you educate them?
Are you talking about our peer educators, or are you talking about the college community?
Just have you.
So for our peer education process, we do have, they have to take specific courses under public health in order to become a sexual health advocate, as well as an alcohol and other drug peer educator. So there's specific classes that they take under the Edward J. Blaustein School of Planning and Public Policy. And they take specific classes, and after they take those classes, they can then apply to be a sexual health advocate or an alcohol and other drug peer educator. The peer mental health advocates, they go through a application process where the director of Hope, so my boss, looks through all the applicants, calls them, and kind of makes a decision to see if they're able to be a mental health advocate. Once they go through an interview process, they're then trained as a peer mental health. Our nutrition advocates, they have specific training and specific classes that they have to take on Hope campus regarding the the chemistry of food. Again, I have no clue. I just like to eat food. I have no clue what the classes are, but they do have to be. They have to take those classes. And Shades Theater. Shades Theater is the only peer education group that doesn't need specific training. I'm in charge of Shades Theater, so any new peer educators that I get for that particular department has to go through the same training that all the other peer educators go through.
And all the other students who are not advocates, they have to attend these classes, or?
And that's where our relationship with NSO and our relationship with the Residence Life actually helps out. Because, like I said, when Residence Life has to hold an event at least once a month, most of the time they call us to do public health information stuff. So we go in and talk about alcohol and other drugs and prevention and STI prevention, sexual health information, peer mental health stuff. So we get invited not only by RAs, but hall directors. We get invited by different organizations on campus. We get invited by faculty and other staff. So that's really how we get our message out. However, we're also present and doing outreach when there's big tabling events. We're always in front of the Rutgers Student Center. We have tabling events in Livingston, that's right here, Livingston Student Center. We're at all the other health centers, again, just to promote our services. So that's our way of trying to outreach. We also have a social media campaign that we're trying to promote. So we're online, we're on Facebook, we're on Twitter, we're on Instagram. And we do have social media interns to help navigate that, to make sure that our messages are being. Yes?
What is your overall staff size in all the health centers?
Ooh, okay. Based on, from what I know, there's around 60 trained medical staff just at our 3 health centers. So from what I understand, there's around 60 of them. That's not counting my office because we're not medical staff, and that's not counting the counseling centers, who I know have a different set of staff. So again, it's just 60 with the 3 medical centers.
If say a student is going to a counseling session or something, parents be notified or?
No. All of our services, both medical and counseling services, are strictly confidential, meaning that we cannot and will not tell anyone that your student access our services. This includes you all, okay? So if you're used to helping your students manage a medical condition or a mental health condition, now would be a good time to have that conversation with them about, all right, let's fill out, because you have to fill out a form, it's on our website, health.rutgers.edu, in order for you to be notified if they ever utilize our services. And again, just because the student gives you permission to for that doesn't mean they can't take it back at any point. Again, this is a conversation that you should really have with your students to make sure there's no gap in communication. Yes?
Conversely, if you feel your student is having
You can, however, that doesn't mean that CAPS will do anything. There is something called the Do Something campaign that's we kind of launched in January, and it's basically a button that's found on most Rutgers University websites that you can click and share a concern anonymously. Basically, what you do is you click on this little sign that says Do Something, and you can share who you're concerned about and what behavior you're actually concerned about. And then someone from Rutgers, Office of the Dean, Residence Life, someone will follow up with that student to make sure everything is okay. So whether it's a student maybe abusing or using alcohol too much, or using or abusing drugs, or someone who may be going through a difficult time regarding stress or anxiety. You as a parent, you as a guardian, can actually go on the website and share that concern yourself. And actually that would probably work much better than calling CAPS directly. Yes?
Does that have to be updated every year?
Health Police Form is probably going to be asked to be updated every year. Yeah. Any other questions? Because the topic that I also wanted to talk to you about is actually related to stress and anxiety. We are now in, is it mid-October? Kind of early to mid-October, and your students have been here for approximately a month and 2 weeks. Now is the time when they're receiving a lot of assignments, a lot of exams that they're studying for, a lot of papers, and I swear to you, they are all due on the same week. I really believe that the faculty planned that just to mess with you. Again, that's just me. So again, but that's one of the things that our students are now encountering. Not only are they handling that, maybe they're trying to start managing their own financial things. So handling money could be stressful. They could be juggling social relationships. Maybe they used to go out with their friends all the time, but now that they're realizing, I need to study, but I can't go out. So maybe that's making a big dip. Maybe they're in a romantic relationship, and because of everything that's happening, that's causing them stress. One of the main things that our students go through is stress and anxiety. We put them in this environment where we want them to learn, we want them to get good grades, we want them to do this, we want them to do that, but we forget that all that requires time and effort. And unfortunately, no one can give past 100%. We say, I give 110%, but you can only give 100%. Once you give more than 100, things start to break down. And one of the things that we have to kind of remember is what are the goals that your student has. What I mean by that is, what do you expect? What are the goals that you set for your students before they came here at Rutgers or before they started their semester? Did anyone ever set goals with your students? Graduate, okay, that's a great goal. That's a wonderful goal. Graduate on time. But let's take that. Let's say that the goal is to graduate on time. What does that mean? Well, no. How many years does it take to graduate on time? 4. Now, when I went to college, it was 4 years. I was told by my parents, you got 4 years. Whatever you do with those 4 years is up to you, but you got 4 years. However, it's not that uncommon for students to stay past 4 years. 5 years, and this is for undergrad. This is not for any type of medical degree or anything. This is for undergrad. 5 years, 6 years. So if your goal for them is to graduate on time, maybe it's time to be a little bit more specific. I need you to graduate in about 4 years, not 4.5, not 4.25, but let's just keep it at 4. So being specific about goals is important. What else? What are some other goals that you set with your students? Yes?
If you get B average, you can live on campus next year.
So if they get a B average,
Then they can live on the campus the next year.
Okay.
Rather than living at home.
Okay, so that reward system, which always works, it never goes away. That reward system is there. If you get a B average for this semester, you get to live, or this semester, this academic year. Okay, this academic year, you get to live on campus. So again, it's setting smart goals. So be specific, make sure that the goal is measurable, achievable. Achievable is the key word here. I know as parents and guardians, sometimes we set the bar maybe a little too high. We think that our students are wonderful, and they are. And however, we have to make sure that the goals are achievable. If they're struggling with math, maybe making them a business major is not the thing to do. Maybe if they pass out of the side of blood, maybe nursing is not the way to go. And I'm just channeling my parents. I'm having this conversation in my head where they wanted me to go to nursing, and that wasn't happening. So again, make realistic and achievable goals. Because some of the things that your students are going through is probably stress related to the fact that they're not reaching the goals that you set for them. So having that conversation with them and letting them know, like, okay, so we're starting off this year, what do you want to do? And and you can have input in this as well, especially if you're paying for half of it, you know. You can have input and say, you know, that's a great goal, here's what I see for you as well. Again, that opens a conversation. You're part of an association of a program where parents are actually involved. When I was in school, this was not here. My parents were kept in the dark, albeit on purpose. But here you are participating in your students' wellness here at Rutgers, and I think that you all are efficacious enough. That's my big word of the day. Efficacious enough to have these conversations with your students. Yes.
Something that happens with our 30-year-old son currently.
Mm-hmm.
When he was here, he had a half tuition scholarship.
Mm-hmm.
And his father said, if you had to keep a B average,
Mm-hmm.
his father said, if you lose your scholarship, and the next year you were at home.
Mm.
He started out living on campus.
Mm-hmm.
So he got up the spring semester freshman year, and his father said, okay, you will be at home next year. And he said, no way. I can't study.
Mm-hmm.
I will work. No, you're kidding. No. His father said, I'm not kidding.
Yeah.
And he lived at home. I don't know who was a bigger punishment for him or me. But the next semester, first semester,
Mhm.
next year,
Yeah.
he got more A's.
Yeah.
And this semester after that, he got what would be in the rest A's.
Mhm.
No trouble after that.
Yeah.
No trouble at all.
Yeah, and again, when we set these goals with us, it gives them some boundaries. It lets them know exactly what they're here for. And the direction I'm going with this is we're not a dry campus. We basically have alcohol or liquor stores on College Avenue. Wait, maybe I shouldn't say that. That's on record. What I mean to say is it's walkable through College Avenue. So we're not a dry campus. So we do know our students do partake in alcoholic drinks, regardless of what their age is. We do say that abstinence is wonderful for students who want to stay away from drinking alcohol. However, we want to focus on safe drinking. That's the message that comes out of our office. And safe drinking means, and this is what we promote, 5 drinks if you're male or 4 drinks if you're female for the night, not the hour. And I make that very clear when I do this presentation. So we do promote that if they do choose to drink. However, you have some expectations too about partying and engaging in social behavior like that. They won't know, students won't know unless you have that conversation with them. This is where you get to share what you want out of their experience. Maybe now is not the time to share how you were the standing champion when you were in college. Or maybe it is. Again, depending on what your relationship is with your student and what you hope for them to achieve while they're here. That can only come through a conversation with you all. So did someone else have anything?
I think another part of the stress is the GPA, because I'm already hearing, but I need a GPA because of graduate school. And I don't know if you were talk about that at all, but it really is stressful because she's already looking towards maintaining a GPA because of graduate school. And I'm saying, just calm down, look at what you're doing today instead of looking. But I think they stress it so much that you need this great GPA.
We got a report back, and I know you're talking about grad school, but we just got a report back from admissions that says, in terms of school of nursing, the average GPA for first years in the School of Nursing is 3.875. And so most of our students, before they even enter our doors, are already experiencing that competitive nature, and that could be very stressful for them. And I'm not saying that's bad. Unfortunately, we are in a competitive environment where GPAs do rule the environment. However, I do understand how that becomes stressful. And unfortunately, the only thing that we can do is refer them to CAPS to talk about that, to make sure that they know that there's ways to cope health in a healthy way, and there's ways to cope in that. Okay? Someone raised their hand.
Our son did change his major.
Mhm.
Actually, he wound up with a double major.
Mhm.
Two totally different majors from what he started with.
Mhm.
And he was very happy.
Yeah.
He has had a very successful career. That was good news.
Yeah, and that's the thing. Unfortunately, when you walk into doors, you have expectations. As students, you have expectations. You have things you want to do. I wanted to be in business school. My math grades were not that good, but my parents had different expectations. Wanted me to be a nurse, and you all know how that ended because I trained at the side of blood. So clearly, those expectations and goals were not meshing. And again, that conversation with your students can help them with the potential stress. There's a lot of things happening. There's a lot of social engagements that are happening for students. There's peer pressure for them to drink if they haven't drunk before. There's pressures to try different types of substances that they had no interest in. There's all that peer pressure. It exists here at Rutgers. It exists everywhere else around the nation. So there is a lot of stress that our students are undergoing. And what adds to the difficulty of reaching out to these students is that stigma regarding going into a health center. Because if they're just looking for counseling, they don't even need their insurance card to make an appointment. They can just walk in and get counseling. I mean, obviously they have to make an appointment, but outside of that, there's no copay, the insurance doesn't even need to be involved as long as it's just counseling. If it's any type of psychiatric services, however, that's when the insurance card will be needed. But any type of stress, and if your students just need to talk about their stress or they're feeling anxious, they can go into any one of our 2 counseling centers and find someone to talk to. Okay? Any questions before I hand out some items? So, the first item I'm going to hand out is the flu vaccine thing. Okay, so that's just for you, and you can give it to your student if you want, or you can give them a call and let them know where the flu workshops are going to be. Again, these are the flu vaccine workshops. The student can actually call our health centers to make an appointment, but these are just additional sessions or additional areas. This blue card is an emergency phone card I was talking about that has all the emergency phone numbers. Yes, we hand these out everywhere, and all of our catering events, all our outreach events, but it's important that you all have them. Because we talked about stress today, I do have a CAPS brochure that talks about all of our counseling services. So, do you mind? I'm sorry.
Yeah, no,
Thank you.
fine.
And finally, remember the Do Something campaign that I talked about. This is the symbol that you're looking for. The back, it talks about what it is, but if you have a concern about your student, and you don't know exactly how to address it with them, but you have a concern, you can share that concern again anonymously by clicking on by going to our website and clicking on this symbol. It should be in our public safety website, health services website, recreation website. So it's usually found in all student affairs websites. So just click on it, read about it. Again, the SWAT team is not going to come and collect the student if you mention it. What they're just going to happen is it's just going to get an email regarding following up on making sure that they're okay. You can say one now.
Excuse me, Mark?
Yes.
How far in advance would you recommend when a student calls to get an appointment?
For an appointment, I would just call ASAP. Because again, we've heard stories where students are trying to make appointments and they can't due to time. I would make an appointment ASAP. And if they don't want to call because it's 2 o'clock a.m., they can go to rhsmedical.rutgers.edu and make that appointment online. Medical.rutgers.edu. So they don't even have to talk to anybody on the phone. They can do and make that appointment online. Okay? Problem. Any other questions? Yes, sir.
Are there programs that are about the evening and the
Yes, our dining services actually takes care of most of that because that's under their purview. However, our nutrition advocates also go around teaching our students one, what to eat, what they should look for, how to read a nutrition label, and also they do this wonderful workshop about cooking basics. So they teach you how to cook healthy food. I think the last time I attended, I cut my finger, but that's just me. Yes, sir.
Are there calorie listings on the menu?
We are slowly working on making sure that all of our all of our food places on campus has that information. I can't say that all of our fast food restaurants has that information, but I do know that Wendy's on our College Avenue campus does have our calorie class. Yep. But we are slowly working with all of our fast food restaurants, at least on campus. Right. I'll also give you my email, just in case you have any additional questions. Sorry I didn't bring business cards. But again, my email is mark, M-A-R-K, .cruz, C-R-U-Z, @rutgers.edu. Okay? I know you've got a lot of information today about stress and anxiety and about our services, so I do know that sometimes the questions didn't come. So if you have any type of questions, please give us a call, please email me, and I will gladly get back to you with an answer.